Yeah, Michael had some family commitments he was going to try to work around. Haley, okay. Well, we'll call the meeting of the Wausau Policing Task Force to order. We thank you for attending tonight's public informational meeting. We'd like to just start out by giving an overview of the task force's work, and we ask that you focus in on the recommendations. And our intent is to have the hearing tonight, take what we've learned from tonight and through other feedback that we've gotten through the community, have a meeting next Monday evening and wrap up our recommendations, and then present the final report to the Police and Fire Commission, the Public Safety Committee, and ultimately the City Council. One of the things that we will have to do as part of that meeting next week is also to develop a plan of action and how we will propose that the recommendations be addressed. So we have a little bit of work yet to do, and there's been a lot that's been done to date. So I think the mayor and I will be giving a quick overview of the final report and the recommendations, and you're in control of the slides.
Yes, I am. So wherever you need me to speed up, I will just follow your lead. So thank you very much. This is probably the 5th time we've presented together. So
Excuse me, before we begin, maybe, well, I guess we will introduce the members during the report. So otherwise I'd introduce those now, but we'll
sure.
do that in the context of the report. So go ahead.
all right, obviously it's not April 13th, but whenever we're finished with this puppy, we will put the right date on there. Maybe I'll let you start off with the acknowledgement, since it's largely...
Well, first of all, there's a lot of people that have been involved in this, and I'd like to first of all thank the task force members, the 7 members, the police department. It's always tough to put yourself under a microscope in these tough times, and we appreciate their openness and willing to share information and data, and participate in training exercises and share that information. And we appreciate the professionalism and the character of the various representatives of the department that have come before us. I'd like to also acknowledge the role that Wisconsin Institute for Public Policy and Service played in our community engagement process. We've had extensive outreach efforts throughout the last year and a half, and we relied heavily upon WIPs for helping with that. But we have before you a series, our findings. We were tasked with looking at the department's policies, procedures, and practices, and try to identify any unmet needs in the community. So we thank again the chief and Matt Barnes and others in the department for their contributions in enlightening us. We also relied upon the district attorney's office, the sheriff's department, and North Central Healthcare and others to provide valuable information.
Right, so why do we even have this Wausau Policing Task Force? So this was started in 2020 because of the national conversation around policing and what constitutes good policing and how we want to keep each other safe. So we wanted to be responsive to the discussion. We were hearing it here in Wausau, but we didn't want to be overly reactive. So we wanted to make sure that folks knew that we were deliberatively considering their questions and comments about policing, and it was very deliberative, obviously, evidenced by it being a year and a half here. But we also wanted to make sure that we continued our vision of excellence. If you ever go to the police department's wall, you will see right there that they have a visionary goal, and it's to be regarded as the standard of excellence in policing. And we know that we can only be that vision of excellence if we work at it. We don't get to relax. So as a background, there's a brief timeline we threw in here. So 2020, Wausau had the largest political demonstration of anyone's memory and history. So that was June 6th. About 2,000 people showed up to march on behalf of the killing of George Floyd. And that was one of those things where people started asking, okay, 2,000 people showed up, what's next? So then Police and Fire Commission also took note of that, and they said, and we had a formal request from the president at that point to make recommendations on policies in Wausau and make sure we're doing everything right. So we created the task force. We took a little bit of time to make sure that we had the right goals and objectives, and then we started meeting in August 2020, and this is our most current meeting. All right, we wanted to make sure everyone understood a little bit about the citizen oversight that actually already takes place. We have two governing bodies and me. So we have the Police and Fire Commission. It's a civilian board appointed by the mayor, but also approved by the Common Council. So they work independently of both me and the council. And then this is actually statutorily required that the PFC, their primary role is to staff the police department and fire department. Public Health and Safety Committee is a committee of the Common Council, and they focus on the policy that guides the department, both police and fire, and along with the police and fire chiefs. And then me, the mayor, or any mayor, day-to-day oversight and management. I don't know if you want to hit this one.
All right, so we looked at, we engaged in a process of deliberative inquiry. We wanted to look at what we do in the police department, looking at their policies, procedures, and we received 2 thumb drives full of documents and other information as well as project overviews. Why do we do it? And we also looked at what the community needs are. Talking to the mental health care professionals, we all members of the task force were encouraged to do ride-alongs to get a better understanding of what the police officers face on a daily basis, as well as the training. And then what are we missing? The needs assessment, the community survey in gaps, and you'll see those reflected in our final recommendations.
This is something I think the community is pretty familiar with, our task force duties and responsibilities. We have 13 listed here. That was in our authorizing resolution, and we asked ourselves several different checkpoints. Are we doing everything that we said we were going to do? So I don't know if we want to read through everyone or if we're pretty familiar with that. Okay. All right. Here we are with our task force. Thank you, first of all, to the time and energy and thoughtfulness that was put into this. Obviously, our chair, John Robinson, thank you for guiding us through this. Our former alder, Pat Peckham, was representative of the city council and still is. And then we had 2 members of our Police and Fire Commission, Michael Loy and William Harris, thank you. And then 3 community members, Kaylee McCauley, Sarah Schneck, and Mike Klemp-North. So thank you all for that. Variety of different backgrounds, various and interactions with law enforcement. This was a really heady group, I think, so we got some work done.
So the task force began meeting actually September of 2020, and we started out with an overview of the department, their policies, procedures. We spent time looking at various national and state studies, including President Obama's Task Force on 21st Century Policing, which talked about 6 pillars of effective policing. We looked at the Wisconsin Professional Police Association's Blueprint for Change, and we looked at the Speaker's Task Force on Racial Disparities. As well as other publications. We spent time looking at disciplinary processes, how they hire, how they fire, officer-involved shootings, use of force, Garrity and Brady rules relative to proper notice and others. We invited Jim Palmer from the Wisconsin Professional Police Association in. We spent a lot of time talking about community engagement and the design of the survey. And we'll talk about that a little bit later. Reviewed the mental health services that are available for crisis services in the community, as well as other needs, whether it's homelessness. And we spent time looking at the district attorney's office in their role in the criminal justice system, the jail and jail diversion programs. Again, looking at survey results, focus group results, and our listening session results. We spent time looking at state legislation, evaluating programs such as a school resource officer, and then spent time looking at what recommendations we would make, and ultimately, we have developed a series of recommendations that we'll present a little bit later.
All right. So obviously throughout all of this, we did listening sessions, both online and in person. We had a great community survey. We had 7 targeted sessions and focus groups with populations that we didn't think maybe were represented in the survey. And then, of course, we had the data capture and analysis thanks to the Wisconsin Institute for Public Policy and Service.
And those listening sessions were held both virtually and online. Unfortunately, COVID interrupted our ability to do a lot of things face-to-face. But we had, again, 7 different sessions where we received valuable information. Those listening sessions were used, or the results of them were used to design a community survey, of which I think about 5,000 copies were mailed out and was made available to the public online. We had 1,231 responses. We were interested in what the public's perceptions were of the department in the community and whether they felt safer today than they did a year ago, any concerns that they have, what needs there were out there, and we also sought demographic information so that we could use that to follow up with focus groups. Generally, when we've done the surveys and others, we've done things we've had listening sessions aimed at Spanish populations among, as well as English, in order to be as inclusive as we can. From the survey data, we saw that there was some differences in answers, although there was general support for the department. You should say not general, there was very strong support for the department, but there were differences based upon a number of factors, including ethnicity, some cultural issues, sexual orientation, age, mental health status, and others. And we wanted to make sure that we did a deeper dive into trying to understand why there were differences. And again, there were differences, but they were incremental, and there was still support for the police department. So we set up a series of focus group meetings and invited representatives in to dig deeper. 2 of those focus groups were held with representatives from the Wausau Police Department to make sure that we understood the perspective of law enforcement in our deliberations, and the other 5 were targeted towards at certain populations.
Right. So we kind of boiled down everything that we heard from the survey, the focus groups, everything into findings. So I guess, I don't know if we want to pop back. Do we want to read through all of the findings here?
Yes, I think.
All right. So I'll start us off. The first finding we had is that there wasn't evidence of systemic racism in the Wausau Police Department. We had a majority of respondents that were satisfied with the Wausau Police performance, but we did find that young, non-white, non-heterosexual, non-homeowners expressed more negativity about law enforcement. We did find that there was about a 50-50 split between whether folks felt the level of safety has changed in Wausau over the last year. But we did find that folks were very interested in tackling issues like mental health and addiction. They think those resources should be a top priority for us. We found that recruiting quality candidates is critical, and we also found that the community gets their information on police activities and other things from social media, but also from other news sources. We had a lot of folks who tuned into Channel 9, I think, was one of the surveys that we found. And lastly, we found the majority of respondents rated their interactions with police in the past year as favorable. So that kind of led us to to bucket off our recommendations. But the top 4 issues that we used were mental health and human services. We want to make sure that we have resources available that will enable our officers to respond appropriately and safety to folks who are dealing with mental illness. We also found that investment in officers' mental and physical health to improve resiliency and overall well-being of the department was a priority for the community. And also cultural competency. We want to make sure that everyone has access to effectively interact and work, but also develop those meaningful relationships with our community, no matter what your background, socioeconomic status, or identity is. And lastly, we wanted to make sure that we continued community engagement and that we on purpose created opportunities for proactive community connections so that we can continue cultivating those good relationships. So if there is a problem in a community that we might not know about, that people feel safe to tell us about it.
So we're going to spend some time going into the detail of what some of those recommendations are. We currently have a crisis assessment response team between the police department and North Central Healthcare. There's a similar team with the Marathon County Sheriff's Department where officers and mental health officers go out. Those services are provided between 8 and 5, Monday through Friday. We felt that it was imperative that those services be expanded into the evening and into weekends, so we're making that recommendation for expansion of that program. Under the leadership of the chief and others, the department has been involved in doing outreach with the homeless community. Those services were provided by Officer Lemeron. I think there's probably a better use of resources would be to have a social worker embedded in the department versus a sworn officer. So we're making the recommendation that the homeless outreach services continue, but that they be done by a social worker versus an officer. One of the things that we found is when we were dealing with people, there were some studies that looked at both the people that were presenting themselves to the justice system, the jail, as well as the crisis center. And there were a lot of common names in the top users of those services. And there's a revolving door, is that people may get arrested, they go to crisis services, and they get discharged, and there's not necessarily the appropriate follow-up. We're proposing that there be strong case management services to make sure that people that, once they receive services, if there's follow-through, to make sure that they're continuing with the services, if there's medication, that's provided to them, and just provide support for those people so that we can break that cycle of recidivism. We're also requesting that the legislature clarify and address the law enforcement's role in the civil commitment process, 5115 of the state statutes. Currently, the officers will take people to North Central Healthcare and wait around for sometimes hours, trying to figure out where that person should be placed, whether it's North Central, whether it's Winnebago, whether there's a medical necessity, and other things, and there's a need for the legislature to address that issue. We also heard that one of the impediments for the homeless in doing some of the follow-up services is their ability to secure transportation, and we're encouraging Metro Ride to look at the services to those. There's currently a study going on the future of the Wausau Metro, and hopefully those results can be incorporated into the final recommendations.
Another bucket that we talked about was officer wellness and training. And one of the things we learned is that it was really important, if you want good outcomes, to invest in very specific employee assistance programs for first responders. And so what we want to do is we want to make sure that we have adequately trained mental health support for officers and enhanced mental health benefits for members of the Wausau Police Department. This was something that came out loud and clear, and we have a pretty good relationship with somebody right now that's doing just that, but we want to make sure that we continue to offer those services. We also want to make sure that we give access to yearly cultural awareness and education training for officers. Much like we have trainings of all kinds, we think it's important enough, and our community is diverse enough that we should continue this discussion. And lastly, when it comes to officer wellness and training, we want to make sure that we're expanding and investing in mental health training resources. That was one thing that we heard in every group, the survey, any of the focus groups. We heard from folks that we need more access to mental health training resources, and getting our officers through that is important too.
In the area of cultural competency, there's currently interpretive services, and that we want to make sure that people understand that they are available, so that there aren't language barriers at the time of engagement with law enforcement, and we want to make sure that they're adequately funded. And then we also are encouraging the department to learn basic phrases in various languages, so when they interact with people, whether it's Hmong, Spanish, or with the new Afghan population, that there's an ability to communicate with them.
And our last bucket is community engagement. We want to make sure that we continue having this conversation, and part of that comes with a formal and ongoing dialogue with groups, whether that's Hispanic groups, LGBTQ groups, Black groups, new refugees, other groups. We want to make sure that we continue it much in the same way we have our neighborhood program that already is pretty successful in individual neighborhoods. This would be kind of an additional way to connect. We also want to make sure we're developing a communication policy that is both multimedia and multicultural. We want to make sure that we're reaching people where they are and we're speaking their language, whatever that is. And we want to continue our partnerships with our research organizations to collect information on social justice issues in the criminal justice system. Chair Robinson has talked a little bit about some of the programs going on with the county as it relates to research and collecting information. We'd like to continue that and expand that with data from what we're doing here. We'd also like to continue conducting a public service campaign about interacting with, I guess we're not continuing, what we want to continue is the regular periodic community survey, but we want to do that's new is conducting a public service campaign about how to interact with law enforcement to achieve positive outcomes, because everyone can probably afford to maybe have a little bit of a brief on that. And so we've had a prioritized list if you want to hit those.
Well, again, the expansion of the priorities were in the Health and Human Services area, primarily with the expansion of the CART team in the homeless coordinator, but we also want to make sure that the employee assistance program is available to the officers at no cost to them. And then the managed care component, we wanted to make sure that we take the neighbor-to-neighbor concept, the meetings, and move that into other populations so we can break down some of those cultural differences or have a better understanding of those cultural differences or perspectives. Those were our top 5 priorities.
Do you want me to? And then dependencies. This was something where we realized we can't do this alone. I guess we knew that. But it became very clear when we were talking about the justice system. It is a system. It's not just Wausau Police Department. It's not just Wausau. We have multiple organizations and agencies, and we need their help and to have good relationships with them to ensure we're giving the kind of service to our community that they deserve and we want to give. So we kind of bucketed this out with our recommendations and how we would need their help. So obviously, if we expand our CART team, it's not just us. We would also need support from North Central Healthcare and Marathon County Sheriff's Department, in addition to some policy direction from the Police and Fire Commission. Same with our homeless outreach services. We can't do that alone. We also need our support from North Central Healthcare and the county and the public. Again, when we're requesting other agencies to help us with things as it relates to community-based case management services, we should probably involve them in this process. So we got to make sure that North Central and the county are on board, in addition to the state of Wisconsin. And of course, when we're asking the legislature to either clarify or adjust state statute, we're going to need all the help we can get, including from the public, to lobby for these changes. Do you want me to keep going?
You want to, we can run through all the dependencies,
Sure.
but
There are dependencies everywhere. So I guess that's what we're trying to get to. We can't do this alone. It's going to require some lobbying on our part and really strong partnerships.
And again, I think that we'll probably be changing the check boxes as we move forward, but again, there will need to be, in our plan of action, a identified process on how we will advance these issues to make sure that they are on the various agendas and in the appropriate settings for future considerations and deliberations.
Yep. And of course, once we're all finished with everything, we do have a lot of these links already up on our website, but we'll have links to everything that we went through, including the survey, the results, any of the interview results or things that we need to look at. So thank you.
So I'd just like to share a couple of observations before we open it up. And what we saw is that quality or character and quality matter. And I think speaking for myself, we saw a tremendous amount of professionalism in the department, and it started at the top and it carried throughout the organization. Through the survey process, we found that we've observed that the police department supports the community, and in turn, the community supports the police department based on the results. I mentioned that we looked at a number of different studies and recommendations, including the President's Commission on 21st Century Policing. And there were a number of action items that were outlined in those reports in the use of body cameras. WASA is doing that. Tracking all of your use of force, WASA is doing that. Having an independent review process when force is used, WASA is doing that. So we really came away with the impression that WASA leads by example. The other observations that I know that I observed in 2 ride-alongs that I did is that mental health issues are everywhere. Within the first half hour of both ride-alongs, we were addressing mental health or substance abuse issues with the officer, and they need support. And police are asked to be both mental health and social workers with a badge, and we need to figure out how to support that role. And public perceptions are shaped by ethnic, cultural, mental health, and economic factors, and we need to be aware of that when we move forward and we try to address issues going forward. And again, the next step is to hear from you tonight, and then develop our final recommendations and plan of action. That completes our work as a task force that's sent up to the city, county, and other parties to take that report and work with it. And before we turn it over to the public, would any members of the task force like to make any comments? Will?
Yeah, thank you. Yeah, I'd like to just kind of give my observations of the process as well. First, I do also want to echo the chairman's comments and thanking the police force for being incredibly professional, for the character that they've shown and continue to show a level of excellence that they strive for. Overall, I think my observations have been this, and then in looking at accomplishments, issues, gaps, and opportunities, there is no perfect person or perfect police force, but I think in terms of where we should be, I think our police force has made valiant efforts to continue to be very progressive and moving forward and making sure that our community is in a good place. Some of the accomplishments, I think, of our police force is looking at their policies, having adopted 8 Can't Wait, looking at the low use of force and other techniques when dealing with the public, practices, their hiring standards, and looking at the surveys and overall view from the community. I think those are all great accomplishments and where we want our police force to be. There are questions about, the issue of systemic racism and those types of things. I think when we look at those issues, I just want to make clear that we're not saying systemic racism doesn't exist as a, and I think we're all part of a system, that enforces laws and other things that have impacts on people. However, what we looked at was whether the policies and practices of this police department in terms of how they move forward, how those affect people, and whether those policies are geared toward continuing or moving forward with some of those policies that are hurtful to people and that cause systemic issues. And that's what we didn't find evidence of. Are there disparate impacts? There are disparate impacts, but that is a result of many issues that we discussed here within our community. And those issues and gaps, affect everyone, including the police department, and how they do their role. Some of those were linked to poverty. We looked at, whether you're looking at the Life Report or anything else, a large majority of our minority community lives in poverty. And poverty issues there's a lot of other issues that then build on those issues of poverty, including mental health, including homelessness issue, including housing and income and transportation and education and social support, discrimination. And some of those issues that people face with when they are dealing with issues of poverty and those disparities that are caused, they may cause more interaction with the police. As we had mentioned, the police have had to play many hats, when it comes to mental health issues, and that causes more interaction, whether they're called or whether they observe those things. A person who might not have a lot of money, in terms of car issues, may be pulled over more because their car breaks down or they're not able to afford a tag. There's more people, in terms of minorities that live within certain areas like downtown Wausau. So you may see called geography in terms of more policing on those groups. But I think it's important to look at all of those factors as to why those happen. And it's not just a simple, it's not just a simple answer that some may want to point to and say that, oh, the police, we think they may be racist in some way. No, I think we need to look deeper at our community and figure out ways we can really tackle issues such as homelessness and mental health. And that's what we've tried to do, take an overall look at those issues. Poverty, as I mentioned, causes a lack of resources. There's health disparities. And largely our minority communities are the largest of those that are impacted. And looking at statistics is sometimes hard to tell because the population is small. So statistically it's hard to point out exactly where to start. I think all of those are places that we want to tackle and should tackle as a community. And tackle those together, with the police department and other resources, though. I think opportunities that we saw in order to tackle some of those issues was, as we have stated, through mental health professionals, whether that be through improving resources for CART or improving help for officers and officer wellness and cultural competency, which may cause some other issues. Ongoing outreach to minority communities and to the media and educational sessions. I mentioned Neighbor, learning languages, and further opportunities to look at how we tackle the homelessness issue, which is a big issue. And a lot of our homeless population also are minorities or vulnerable populations or have mental health issues. So I think there is opportunity. I don't prescribe to either saying that our community is completely wrong, that these issues don't exist within our community as a whole, or saying that by highlighting how great a police force we have, we're saying that our police force is perfect and there's no areas of improvement. There's always areas to continue to improve and continue to work on. And I think we both have to do that as a community and as a police force and continue to strive for excellence. So that's sort of my overall take on a number of things that I've seen, and I think our recommendations echo that, whether we're talking about those accomplishments or those issues and gaps or disparities or disparate impacts or opportunities moving forward. And I'm looking forward to seeing those recommendations hopefully get approved. And I think in revisiting sort of, yearly, as we had mentioned, and through surveys, seeing the progress that our community can continue to make. So again, I just want to thank the police department. I want to thank our community and all the people that have attended this session today, and for everyone that worked really hard on this task force to move forward. I think we all want to see our community succeed. Thank you.
Mike?
I'd like to echo those comments. And I think when we talk about systemic racism, I think when you review the document, you realize that law enforcement is one part of the system. We heard from multiple different actors and agencies within the day-to-day life of our law enforcement, of our citizens. And so we are tasked with looking at the Wausau Police Department. And, there's no clear evidence. But that systemic racism is built there. But the reality is they're one part of the bigger system. And as Committee Member Harris said, we all need to gather around on this and invest in the, CART program, invest our efforts in the community to assist and aid the system in general to overcome the challenges that we're seeing.
Pat?
Yeah, thank you. I'd also kind of key off the chair's remarks about how when we started out, we read these national reports about all of the things that a police force should be doing. And I think individually we read them, and, in preparation for some of our first meetings, we all said, oh boy, that's a good one, we should all be doing this. And then we got to the meeting, we said, we should really be doing this. And the chief said, well, we already are. And then the next one, we should really be doing this too. Well, we already are, we've been doing that for 2 years. Then we got to another one, and should really be doing this. Well, we already are. And so they are on the ball, and we're very impressive in terms of being kind of up with the state of the art. I think we have anything that's dangling here, it is the fact that the community is questioning our finding that we didn't see any evidence of systemic racism in our police force. And I think there's a general kind of a line of thought among some in the community that existed before this task force was formed and is going to exist afterward, that of course, these are cops, they're going to be bigots, of course. And, it's accepted, in their mindset, and it's going to be hard for them to let that go. One of the things, going back to kind of the early days of this committee, was that one of the things that we did was that the chief and perhaps others in his department described for us the scrutiny that new officers receive and how they are screened for attitudes that we do not want to see in our police force that's interacting with our community. That was very impressive, how they were able to use these screening tools to make sure that that sort of thing did not get into our personnel. And so I think that's one of the issues, respectfully to the chair, I think that we should address at our final meeting. I don't know if it's going to result in any changes to our report, but I would ask that we review that, and if the chief could kind of resurrect some of that information and describe for the interested public and refresh us on the steps that are taken to make sure that we don't have new personnel coming into this department that are have attitudes that we don't want to see. I think we're doing very well on that, but average citizen is unaware. So if we could get that out, I think that would be helpful. Thank you.
All right, with that, would anybody like to comment on our recommendations or provide any input? If you would, just come up to the microphone, and if you could identify yourself.
How you doing today? My name is Jordan Leszewski, and a couple questions. So my first question is so this is from the 2020 recess. We're at pretty much the top 7 and 6% in the state for mental health. And so obviously I asked, like, where do we get our evaluation for this year? Because I noticed we were doing an exceptional job. And it happened to say that there was out of 68,324 people, 4,023 were served. Now that breaks down to less than 5% of the people, and crisis management was 1,988. The med management was 1,649. The highest intensity was 250. And so I just asked what kind of transition to more of the mental health this year than based on the numbers for last year.
Are you looking at data from North Central Healthcare?
Yeah,
or-
so that's a great question. So I'm looking at the county health rankings. That's kind of where I got this information off of. And it actually states that we're doing a tremendous job, and we're actually in the top 10 as far as like what we're doing in our community in this area. Go ahead.
Well, we looked at it from the perspective of law enforcement and engagement. We didn't look at the whole mental health system. I think those questions probably would be better directed at the North Central Healthcare staff.
Absolutely.
I know that there are some issues, particularly in the recent last 2 years due to access issues and COVID limitations where some of the behavioral health services weren't accessed as well, and they tried to move to telehealth. There are a number of issues, but our recommendations, follow the line of how does mental health services interact with the job and responsibilities of the department, and therefore the request for expansion of CART, and then the request for the mental health case manager that hopefully would address some of that follow through. And we know that there are shortages of professionals. I was just at a meeting today where a number of people were together and pointing out there's significant shortages of mental health providers. And the current regulatory system limits or is slow in processing new ones, and there's just a shortage of people to provide those services.
Yeah, absolutely, and I think that that's great that you brought that up. And like I said before, I think that it's definitely important to take the time out to just say, I think that the police have the toughest job possible. And I'll be 100% honest with you. So I actually just recently took a criminal justice program and graduated from the University of Phoenix with Associates of Arts. I actually volunteer for the CIA, and so we do a lot of database gathering and stuff like that, and obviously been helping your agency as well as other agencies kind of develop them skills to be able to kind of be better and be elite. And so really think that it's definitely important to take that time out to just recognize, again, it's one of those things that are definitely hard to, I think, put into words, but overall, I just wanted to condone the police for everything that they do. I think that they're important, they matter, and I feel like they deserve a pat on the back for this whole policing task force that had to happen. And, and it's unfortunate. And again, I just wanted to take the time out to say that I respect the police for what they do, and I think that the mental health stuff should be allocated more towards them, because I feel like that they don't have the easiest of jobs of people, when everybody's running their name into the ground or, whatever's happening in our society, these people have to stand tall, and I commend them for it. And so that's all I really have to say about that. So,
Well, thank you for your
yes,
comments,
sir.
Jordan.
Thank you so much for taking the time.
Anyone else wish to make a comment?
My name is Benjamin Erickson. Just again, want to thank you guys for taking the time to do what you've done with all your task force and all the time and energy that you've spent into that. And also, just to, give my support for the expansion of the CART team. For sure that's needed. Myself has experienced that or seen that team in action with past employments. So I do think that they do need some extra expansion there. Question regarding the outreach position. are you guys recommending that that be one position and then within partnership with a social worker?
I think the recommendation was that it be a social worker position embedded in the police department.
Okay.
So I think the details on how that would be staffed and the staffing pattern would be determined by the chief.
He
Pat?
also recommended, though, that what we have currently is basically an 8 to 5 service. One of the things we thought was important was to get into evenings and weekends. So I don't think we can do that with one body. So I think that's where we're headed,
Okay.
or we hope to head anyway.
Sure. Yeah, and that's something that I guess, would be beneficial, I think, with it. We all know how case management goes. We all, even through the social services or the healthcare system, they have a huge caseload in itself. So even for one person to handle the outreach part of it, going out on the street, building those relationships, plus handle all the case management, reaching out to other resources or other agencies that might be able to provide resources to the homeless as well. So if you would consider that, or recommend that versus just one position versus two, be recommending it be two positions, just to kind of help with that caseload and the time, expansion of the time as well. Let's see. And then to kind of go along with that too, the case management part of it, also partnering with the healthcare center in the community-based case management system. Again, we could have outreach and have somebody do that and have a social worker do that. But again, it's a lot of case management, I've experienced as well in my current position, Monday through Friday, my job, I pretty much come in contact with a lot of the homeless population on a daily basis. Some every day, some every couple of days, some every week, every other week, things like that. So, they share a lot with me, with their experiences, with case management, and, they might be assigned a case manager, but it's hard to get an appointment with them because of their caseload. So they're, might be seeing their case manager, once a month, wouldn't it be beneficial if it was more often, so they can get that guidance more often. And with that too, I've seen individuals go through the case management, go through that process, from when they get the outreach on the street, they get help with the case manager, whether it's within social services or the healthcare center. We provide services to them. They get services from other agencies as well. And they get on their feet, and they get there, and then, the services kind of just fade because they feel that, they're in a good place now. They're better from where they were on the street. And then, again, those meetings or that case management phases almost on to nothing. So then they're back, that cycle continues. So then they're back on the street because they're not getting that continued support or more support. So then that process starts all over again. So, investing that more time in case management for sure is going to be very beneficial with that. Regarding to as far as the transportation recommendations through Metro Ride, I know that, if I'm not mistaken, that they have kind of are working on a 5-year plan for their system. I know that, the city and the community have talked about for many years expanding the transit system, looking at the routes they have now, expanding routes, and that's been discussed a lot in the past. And that's kind of where it's been in discussion. There's been no action with that. So for sure, not only do the homeless population need more access to certain areas, whether it be Rim Mountain or out to Schofield, Rothschild areas, but in general, I believe that, all citizens need that access as well. Whether they have a job, but it doesn't pay that much, they're just getting by, they don't have reliable transportation, so they have more accessibility to different areas of the city. I'd like to see that recommendation, so it's a good recommendation with, trying to expand that transit system to go to more areas. More important, if important is the right word, but, like Rib Mountain where there's more jobs and concentrated in that area. More areas like grocery stores, things like that. Same thing with getting on the Target area or Weston or Schofield or Rothschild out there. So, one question too that I have with your recommendations, have you guys ever thought of putting like aggressive timeframes on your recommendations as far as action?
That'll be part of our discussion on the plan of action.
Okay.
And we're, quite honestly, we won't be in control of the report. The task force will go away. And then it'll be up to the city and administration and the police and fire commission and council and others to look at it. But I think the thought is we would like to try to see these addressed as soon as possible.
Sure. Yeah. And for sure, again, going back to the many discussions about previous things in the past, it seems like it's, whether it's a transit, whether it's the homeless population, affordable housing, things like that, it seems like a lot of it we talk about. We come up with a plan, whether it be a 5-year plan or 2-year plan or whatever else, and then something happens, so there's not always action with a lot of things with that. So that's all the questions or comments that I have about that. I just have one other thing that just kind of hit a little spark in me or nerve in me, if you would say. I'm not sure what your name was again. What's that? Okay. When you were talking about the police department and officers and their, I guess I'm questioning your comment when you brought up when you mentioned bigots, and you said that, and correct me if I'm wrong. I'm asking guys if you said that cops are always going to be bigots. You said that. If that's what I heard you say.
I don't want to get into a debate.
Okay.
I think if you
I
want
think I can explain it.
Okay.
I was just kind of giving voice to what I feel are the opinions of some in the community.
Okay.
I do not believe that.
Okay.
To be totally honest, I came into this thinking we may have some bigots in our police department. I mean, the police image nationwide took a hit, especially with the George Floyd thing. But I've been very pleasantly surprised at the scrutiny, like I said, that the new officers get, the monitoring that all officers are under, and I am in no way saying that our police department is harboring bigots.
Okay. Thank you for that clarification.
Very good, thank you.
Yeah, and just, with that, and, the Wausau Police Department does a great job in what they do. Years ago, I have a degree in criminal justice, worked for Wausau Police Department many years ago as a CSO while I was in college, and was a police officer outside of the area for 2 years, and all that too. So I know back in the day when I was a police officer, it was much, much different than the environment is today. I know how hard it was as a police officer back then, and how hard it must be now to be a police officer. So thank you for the clarification. I appreciate that.
And thank you for your comments,
All
Benjamin.
right, thanks a lot.
Any other comments? Anybody else like to make a comment? If not, we thank you for your participation. And again, we will be meeting next Monday to develop that plan of action and to finalize our recommendations. Pat?
Did we receive anything? I read that our city's Liberation and Freedom Committee discussed the recommendations and the report as it stands now, and there was some disbelief, I guess you would say. Did we get any formal communication from them, or should we be having staff contact them and invite them to our last meeting to air out any
I
concerns
think
they
that
may have?
I did a presentation to them. They're aware of tonight's meeting. I would be very leery of inviting a group without inviting everyone to our meeting. If they have issues, concerns, I would ask that they communicate those to us, because if we start with
So
one group,
everyone
we're reopening everything. But again, we did meet with them. There was nothing that formally came out of it when I was there. I don't know if they've taken subsequent action, but again,
Okay.
we've had listening sessions, we've had surveys, we've had focus groups, we've had presentations, we've got a hearing tonight. There needs to be, if people have comments, please provide those before the meeting. And we can consider those as a task force.
So it would appear that the concerns that those people had were aired, and they felt satisfied with the answers they got last week?
It wasn't, I don't know if they met last week. I met with them.
Whenever the last meeting was.
We met with them and gave them the presentation. I think there were some concerns, but I think they focus in on the recommendations.
Okay, and they were aware of this and they didn't come. Okay, thank you.
Will?
Yes, thank you. There was one other thing I just wanted to touch on briefly.
And again, this is a public hearing for the, if we're into the discussion of what the committee or the task force wants to do, I would ask that we do that on Monday.
No, this is in regards to, in terms of discussions with the public, that we're just
okay.
addressing some
All right.
public concerns. So I just want to say, in terms of moving forward and how this should move forward, because I think the goal I think we should look at in having this is that I think some people have viewed this as, from a community perspective, as us having this because our police force did something wrong. And that was not the purpose. Or some members of our police force may have felt like the reason that we were doing this was to punish them for something that was out there in other communities. I think rather than look at this, because I look at this as an opportunity, and this is something that I think a lot of organizations go through in terms of a review and evaluation. I think that's how we should look at this, rather than as something negative in terms of an investigation, but moving forward as a evaluation review. And the difference is, investigations usually are just purely reactive to something that has happened, whereas reviews and evaluation, just like a job evaluation, is both reactive and proactive in terms of how you move forward and how you improve. And I think police forces, and they're public servants, and public servants comes with the territory of being should be transparent and accountable. And I think our police force is, and I think this is in the mission of striving for excellence. So I hope that both our police force and our community feel invested in the report and the recommendations that we've made, and they are good with how we move forward, because it's going to take both the community and the police force to continue to work together, to believe in the mission, and to have these conversations year after year, and continue this process in order to move forward and really meet the mission of striving for excellence. So I hope that addresses maybe some of the concerns I think people had when they viewed what we were about or what this was about. Because I'm grateful for the experience, and I hope our police, after having gone through this, have seen how much our community depends on them and are grateful for them. And I hope our community has felt heard through this process, and that there's an opportunity moving forward, continue to work on the issues that our community faces that will hopefully make us all better. Thank you.
All right. Again, thank you all for coming, and we will be meeting at 6:30, and is it 6:30 or 7? On Monday. 6:30 on Monday the 23rd. So with that, we are adjourned.